Hey guys, Dr. Biandello again here, Balanced Bodywork Clinic in Broadview Heights. As always, be sure to like us, share with your friends, tag us, tag your friends on Facebook and on Instagram at Balanced Bodywork Clinic. But today I wanted to go ahead and show you something different. We have Michelle here, who is a massage therapist. And as you can imagine, it's a pretty strenuous job working on people all day long. And you know, she's been experiencing a lot of really kind of symptoms all over the place. Neck pain, mid-back pain, low back pain, and so we're going to go ahead and address a little bit of each of those today. So when looking at Michelle and when examining Michelle, the first thing I noticed with her is that she just has a ton of tension. You could probably use a massage yourself, right? But in the lower cervicals, upper thoracic spine, just a lot of tension within the traps, within the upper and middle traps, and then down into the rhomboids, even out into the lats and everything. So a lot of pushing motion when working on clients. So as you can imagine, she's going to have some effects because of that. So when looking at her neck, the first thing I notice is that there are definitely some rotational restrictions and some lateral flexion restrictions within her cervical spine. So we're definitely going to make sure we address that, and really kind of on both sides. So particularly C4, C3, C4, and C5, C6 on the right side. She also gets a lot of tension and a lot of buildup of tension within the cervical thoracic junction. So right at like C7, T1, that's a pretty common area whenever somebody's kind of flexed over and bent over and working in that position. So we'll definitely make sure that we address that. Moving down into her thoracics, or I'm sorry, her lumbars, definitely a lot of hypertonicity within those lumbar paraspinals. Some rotational restrictions on both sides, and also within the pelvis as well. So we'll go ahead and have Michelle go face down here. The first thing that we're going to look at is that cervical spine and that CT junction. So we're going to focus right in there. Go ahead and take a deep breath. Good. Same thing here. Good. Okay. Being a little stubborn, so we'll go ahead and try to get that a different way. But let's go ahead and get this mid-thoracic spine here. So a lot of tension in here, right around T6, T7. Have the patient take a deep breath and let it out. Good. One more. And out. Good. Good. Okay. So let's go ahead and look at the low back and the pelvis. I'm going to have you go ahead on your side, face me. And bottom leg straight. And so Michelle's problem is specifically down here in the pelvis, right at that SI joint. So I'll go ahead and look up at the ceiling, take a deep breath. Good. Okay, other side. And on this side, it's her lower lumbar, so L4, L5, right in there. So deep breath. Good. And then go ahead and face up. Let's look at the cervicals again. Come right in here, just relax that muscle for me. There you go. Good. And then same thing here. Just relax that. Good. Okay, come on up. And go ahead and swing your feet around that way. How's it feel?
Good. I feel really good.
Okay.
I feel like the tension's a little bit loosened up.
Good. All right, guys. Well, thanks again for watching. Our massage therapist here, Michelle. Be sure to like, share, tag your friends. Anybody that you know that is experiencing similar symptoms or conditions, go ahead and refer them to us, and we can help them out. Balanced Bodywork Clinic, Dr. Biandello. Thanks again.